Thank you for joining us here at NJ4S Union for our winter webinar series for this month of December. We are discussing hope and healing, wellness through compassion, awareness, and rights. For this week, we'll be discussing protecting the mental health of children living with HIV. Here to share her thoughts on that topic is Kris Delgado. A little bit about Kristen. She is one of our prevention consultants here at NJ4S Union. She has recently completed her master's in public health with a focus on health systems and policy research. Her previous work included working to end the HIV epidemic in Essex County and to foster well-being for the LGBTQ plus community in schools. Kristen is passionate about empowering the communities of the LGBTQ plus, disabled, and survivors of domestic violence. And this passion has changed how she practices public health, especially by focusing on harm reduction, equity for all, community health interventions, and mental health issues. Outside of work, Kristen is working on improving her health through strengthening her body-mind connection. This is done through having a movement practice and a mindfulness tea practice. When not focusing on school or her well-being, you will find her trying new recipes or enjoying a new book with her cat. We now turn it over to Kristen. Kristen?
Thank you so much. Welcome, everyone, and thank you for joining us on this World AIDS Day. Today, we gather with a shared purpose to shift the narrative from simply surviving HIV to truly thriving with it. Our focus is going to be on creating a holistic well-being and focusing on the physical and mental health of children and adolescents on this journey. Over the past decades, there has been many advancements made in the treatment of HIV. So let's catch everyone up. What is HIV? HIV stands for Human Immunodeficiency Virus. It's important to think of your immune system like your body's army. It's designated to fight off infections and diseases. HIV is a virus that attacks and weakens that army, specifically focusing on a key soldier called the CD4 cells. If left untreated over time, HIV can severely damage the immune system, so the body struggles to fight off any infections and certain cancers. At an advanced stage, this is known as AIDS, acquired immunodeficiency syndrome. So, with our current treatment, it is often referred to as an antiviral treatment, or ART. It is either a small pill or a monthly injection that one can take. When we are taking that medication, it is important that we become undetectable, and within HIV healthcare, there is a saying called undetectable equals untransmittable, or U equals U. Basically, what happens is within our body, the viral load should be ideally below 100. Once it hits below 100, it becomes undetectable. When the viral load is left uncontrolled and it goes over 1 million, that is when we hit AIDS status. But normally, once somebody is identified as living with HIV and is taking meds, it takes 1 to 6 months to become undetectable. Then once that undetectable status is maintained for 6 months, there is no risk of transmitting HIV to other partners. So, how is HIV transmitted? It is transmitted through 5 different fluids. It is blood, semen, vaginal fluids, rectal fluids, or breast milk. The main routes of transmission is sexual. HIV can be transmitted through unprotected anal or vaginal sex without a condom, or PrEP. PrEP is a medication that prevents HIV, and it is less common to be transmitted through oral sex. It is also commonly transmitted through sharing needles or syringes, sharing equipment for injecting drugs, steroids, or hormones is a high-risk activity. And last one, the one that we are focusing on, is mother to child. This is also known as peritoneal transmission, when an HIV positive mother can pass the virus to her baby during pregnancy, childbirth, or through breastfeeding. So there's some really important statistics for us to know. In 2021, we know that only 13% of diagnoses were done for kids aged 13 to 24. pediatric HIV is incredibly rare. On average, the most common age to be diagnosed is between 25 and 34. We also have to address a lot of misinformation that has existed since the 80s about HIV. It is important to know that you cannot get HIV from hugging, kissing, or shaking hands with somebody. You cannot get it from sharing food, drinks, or utensils, using the same toilet, coughing, sneezing, mosquitoes, or other insects, swimming in the same pool, and donating blood. It's important to highlight donating blood because while it is one of the main routes of transmission, there are strict testing guidelines around it. It is also important to know how history has changed how we view HIV. The CDC, during the AIDS crisis and beyond, put out a myriad of different posters to try to educate people. You won't get AIDS from a public pool is a very common one. We also have Princess Diana at an orphanage in Brazil. She was considered revolutionary at the time for being willing to hug and shake hands with people who were diagnosed and living with HIV. Lastly, we have the I have AIDS, please hug me, I can't make you sick poster. This is an infamous poster from the 80s, which has become a worldwide icon to fight HIV and AIDS discrimination. This was inspired by the experience of Ryan White, a 13-year-old hemophiliac who experienced discrimination from schools. This poster reflected the change in tone of media surrounding the AIDS crisis after Ryan's White courageous battle. It helped shift the focus from ignorance and discrimination to acceptance and newfound knowledge that people with this fatal disease still deserve compassion. This simple yet powerful message has inspired many spin-off posters used by international AIDS awareness and education programs. It is also important that we know who Ryan White is. As I mentioned before, he is a 13-year-old who was diagnosed with AIDS after receiving a blood transfusion in December 1984. While living in Indiana, doctors gave him 6 months to live. During this time, Ryan ended up living a lot longer, and when he attempted to return to school, he experienced a lot of AIDS-related discrimination within his Indiana community. Him, along with his mother, Jeanne White Ginder, he rallied for his right to attend school. He gained national attention and became the face of public education about this disease. Surprising his doctor, Ryan lived 5 years longer than expected. He died in April 1990, 1 month before his high school graduation. In honor of that, Congress passed the Ryan White Comprehensive AIDS Resource Emergency Care Act in August 1990. This act funds a lot of the HIV programs currently within the United States. So now we're going to move on to pediatric HIV. Once again, pediatric HIV is one of the most rare forms of HIV. Rates of pediatric HIV has gone down due to access to prenatal services where women will also often receive screenings, including HIV screenings. Also, the use of HIV medication and other strategies have helped lower the rate of perinatal transmission of HIV to 1% or less in the United States and Europe. Access to antiretroviral therapy has also made a large difference. When children have consistent access to art, they are able to live long, healthy lives. The treatment has advanced to being a single small pill or a monthly vaccine. So, with this in mind, a lot of things can affect medication adherence in children. A busy parental schedule makes it hard to take HIV medications at the same time every day. Sometimes children will experience side effects from HIV medications. Issues within families, such as physical illness or mental illness, unstable housing, or drug and alcohol abuse, may lead to a lack of medical adherence in children, lack of insurance to cover the cost of these medications. Lastly, the child's age and developmental stage can make it harder for them to receive those medications. We're going to look at mental and emotional well-being. When we're looking at addressing stigma, we should think of Princess Diana when she said, HIV does not make people dangerous to know. You can shake their hand and give them a hug. Heaven knows they need it. So, there are 3 different types of stigma we're going to address today. First, we're starting with internalized stigma. It is not only for children, but for adults. It is important that we use neutral language of saying you have HIV or your body has a virus versus you are HIV positive. This separates the condition from their identity. It becomes something that they manage and not who they are. It's also important to normalize medicine as a tool. This is part of their health experience. This normalizes their experience and makes it understandable to them and later on to their friends. It's also important to create a sense of pride, making a big deal over undetectable viral loads. Saying things such as, your numbers are amazing, your medicine is working so well. This teaches them that their efforts and adherence to medication leads to positive outcomes, overall empowering them. It's important to have the medication be viewed as a symbol of self-care and strength and creating those positive associations with taking it. Lastly, it's important to remember that the children that are currently living with HIV were not raised with the same stigma that a lot of us adults were. So it's our job as caregivers and allies not to just comfort them after they've been hurt by stigma, but to actively build an environment that is full of truth and confidence so that stigma has no place to grow. We also have to think about preventing stigma in the home and with our family. So it's important whenever we are talking to a child about health issues and their chronic illnesses that we say in a calm and matter-of-fact and loving to show that it is a serious topic, but it is not scary. It is important to normalize it, treat medical appointments and the rest of the doctor's appointments as a normal part of life. And when we model that open and positive communication, that destroys stigma, ensuring that the child never overhears adults talking in hushed tones or worried conversations about their health. It's also important that we ensure that the child is informed in an age-appropriate manner. Lastly, we have to think about preventing stigma from outside the home. When it comes to our young children, they might not realize the power that stigma holds. So it's important that we rehearse answers to invasive questions to protect the child's privacy. Some common questions that you can respond to is, why do you take medicine? It is just something I have to take to stay healthy, like a vitamin. If someone asks, do you have a disease? The child can answer with, it's a private health matter, but I'm perfectly healthy and it's not something you can catch. It's also important for us to role play them walking away and telling a trusted adult. We can empower them with phrases like, what you're saying is not true and unkind. This gives them a shield of words while the adults figure out how to intervene. It's also important that we are strategic to what adults we disclose our child's status to. Overall, the rule is, does this person need to know to keep my child safe and healthy? The school administration and the nurse should absolutely know. A teacher and coach might not need to know all the details. A common thing that you can say is, my child has a medical condition that is well managed. In case of an emergency involving blood, please use universal precaution, and here is my phone number. It's also important that when we do this disclosure, that we are framing it in a confident way. We, as the support system to the child, it is our responsibility to educate others and provide simple resources. We are setting the tone, and if we act like this is a normal health matter, they are more likely to respond with kindness. We also have to address behavior. It's important to remember that we will only see the tip of the iceberg. This can look like behavioral issues at school, medication refusal. They can also experience a withdrawal from social life. Underneath that iceberg, there may be anxiety, fear, grief, a need for control, or sleeping issues, along with anger. Some children may experience anxiety and hypervigilance. This can look like clinginess, difficulty separating, trouble sleeping, constant worry about their health or yours, asking what if questions. This could look like stomach aches or headaches with no actual medical cause. Children may often view the body as a betrayer. Children with chronic illness can feel like their own body is a source of danger. Is a simple headache just a headache? In their mind, it could be the virus winning. This creates a constant low-grade alarm in their nervous system. It is also important to remember that for children with chronic illnesses, medical trauma is really common. These regular clinic visits, blood draws, and procedures, while necessary, can be inherently traumatic. It is important that they reinforce the message that their body is a problem to be managed. This can make them hyper aware of any physical sensation, once again leading to that anxiety and hypervigilance. Children may also experience depression and withdrawal. This can look like a loss in interest in friends and hobbies, increased fatigue, irritability, sadness, statements like "no one likes me" or "what is the point?" It is also important to note that fatigue is a common symptom for those living with HIV. So it's important that we have conversations with our children about how they're feeling and keep up with their medical appointments to be able to differentiate if it is a response due to the virus or something else. Children may often experience that chronic sorrow. This would not just be a passing sadness. It's a grief for the quote-unquote normal life that they see other children having. This could be a life without pills, without doctor's appointments, or without having to keep secrets. Children may also experience isolation. The need for secrecy can make them feel like they're living a double life. They may pull away from friendships because the effort of hiding a part of themselves is exhausting. They can often feel like an imposter in these relationships. Lastly, we'll sometimes see regression. This can look like a potty trained child having accidents, a previously independent child wanting to be fed or dressed, or just baby talk. Children may find safety in the past. When the present feels overwhelming and scary, the subconscious mind retreats to a developmental stage when they felt the safest and most cared for, usually early childhood. When this is being used as a coping mechanism, it's important to remember that it's not a conscious choice or manipulation. This is the brain's way of saying, I cannot handle the demands placed on me right now. I need to go back to when life was simple. As our presentation comes to a close, it's important to remember that one's HIV status is just a chapter in their story, but not the title of the book. So it's important that we are gentle with ourselves as caregivers. This is a journey and you're learning as you go. It's also important to remember that you are not alone. There are organizations, support groups, and helpful materials out there. Let them be a lifeline for you and allow them to support you. Lastly, carry this hope forward. It is important to share your knowledge with your friends, family, and your community. Be the one that dispels the myth, who challenges the stereotype, and who extends a hand of compassion. Once again, HIV treatment has changed a lot over the past few decades. It is no longer a life sentence. Many people living with HIV, as long as they have access to their antiviral medications, will live long, healthy, and normal lives. Thank you so much for joining us today. I hope you have a wonderful rest of your day. Please share any comments or experiences or your thoughts about this presentation.
Okay, I just want to say thank you, Kris, for that wonderful presentation and all that information that you did share. Please leave comments in the comment section below the video. We will also leave a feedback form in the details section. Thank you for joining us here at NJ4S Union. You have a great day.